What's going on, all of my healthcare brothers and sisters? I hope that you are having a wonderful day. We are here to help you pass your NCLEX and nursing school exams like a boss, and today we're going to be discussing hemoglobin lab results. Let's get our nurse on. So to begin with, let's talk about whole blood products. So when we're looking at our complete blood counts, or CBCs, this is the general overview of what's in our whole blood products. So our blood is about 55% plasma and 45% formed elements. Our plasma is made up of 91% water, 7% proteins. That includes our albumins, our globulins, fibrinogen, and prothrombin. 2% other solutes, gases, ions, nutrients, regulatory substances, as well as waste products. Our formed elements are our red blood cells, which is usually in the millions, platelets, and our white blood cells, which can be further broken down into neutrophils, eosinophils, lymphocytes, basophils, and monocytes. So what is hemoglobin and why is it important? Well, hemoglobin is a red protein responsible for transporting oxygen in the blood. Its molecule comprises of 4 subunits, each containing an iron atom bound to a heme group. So when it comes to normal hemoglobins, it's really dependent on gender. So a female is going to have a normal value between 12 to 16, and a male is going to have a normal value between 14 and 18. So let's talk about pathophysiology of hemoglobin. Like we discussed about before in our red blood cell lecture, if you haven't checked it out, make sure that you do. It'll be extremely helpful for this lecture. We know that hemoglobin is generated in the bone marrow. So hemoglobin is that iron-based protein that is circulating with red blood cells until their destruction. Once they are broken down in the spleen, that iron component gets recycled to the bone marrow for additional red blood cell production. So the main function, like we discussed before, is it helps carry oxygen, carbon dioxide, and other gases throughout the body. Something additional that's important to note is we have 2 different kinds of hemoglobin. We have oxyhemoglobin and deoxyhemoglobin. So with oxyhemoglobin, that is when oxygen is attached. So if oxygen is attached to our hemoglobin, we have oxyhemoglobin. Once that oxygen is released to the tissues, there is no longer that attachment of oxygen. That particular kind of hemoglobin is called deoxyhemoglobin, meaning that there's no attachment of oxygen to that hemoglobin. So we can't talk about hemoglobin without talking about what's up with that oxyhemoglobin dissociation curve. So it's a curve that plots the proportion of hemoglobin in its saturated form on the vertical axis against the oxygen tension, which is that partial pressure of oxygen in the blood, on the horizontal axis. So it's really an important tool of understanding how blood carries and releases oxygen as it relates to oxygen saturation, which is our SO2, and our partial pressure of oxygen in the blood, which is our PO2. So normally we're going to have a high PO2 in the lungs and a low PO2 in the extremities because oxygen comes into the lungs, it's going to be high. By the time it gets to the extremities, it's going to be low. So if you look at this graph of the oxygen dissociation curve here right above my head, you're going to see that that blue line is the baseline curve. So if we have any kind of shifts, it's going to be dependent on what's going on with our oxygen, right? So if it moves to the right, it's going to be a shift to the right. If it moves to the left, it's going to be called a shift to the left. So if we have a shift to the right, that means we have a less attraction to oxygen. And that can be due to increased temperature, increased CO2, as well as a decrease in pH. However, if we have a shift to the left, that means we have more attraction to oxygen. So we're going to have a decrease in temperature, a decrease in CO2, and an increase in pH. This can be a little bit confusing, so let me give you an example. So let's take a look at a septic patient. The lungs may start to fill up with fluids as the body begins to third shift due to the increased permeability of the alveolar spaces that cause an increase in CO2 since it is unable to be released. Lactic acid production is going to increase as sepsis persists, causing a drop in the pH. And more times than not, you're going to see an increased temperature due to that infection. So when we have these septic patients, because of all of these things taking place, we're going to see a shift to the right, and we're going to have less attraction to oxygen. Why? Because the body is going to be giving up oxygen more easily in response to that high temperature, high CO2, and decreased pH to help oxygenate the body. I hope that clears up the oxyhemoglobin dissociation curve. I know it can be a little bit more confusing. If you want to talk about it some more, I'm happy to. Make sure you leave your questions down below. I love answering them, but again, this is really important when we're looking at what's going on oxygenation-wise with our patients. So when we're obtaining hemoglobin labs, the tube we specifically want to use is our lavender top with EDTA. It helps with that clotting. It has that anti-clotting to keep the blood from clotting. So lab specimen techniques with this, every tube has a negative pressure inside. Once that needle is inserted into the tube, the blood is going to rush in. You never want to push blood into a test tube, because if you do, it can cause hemolysis, which is the breakdown of blood cells, and thus decreasing that overall hemoglobin count, which can lead to false treatment. So some things that are important to note is you want to make sure that you have the appropriate needle size as well as tubing. So you should have at least at a minimum a 20 gauge needle for best results against the breakdown of these blood cells. So looking at abnormal values and causes, if we have an elevated hemoglobin, it can be from a number of things. We could have inadequate tissue oxygenation, low perfusion of the blood. You see that a lot with our COPD and pulmonary fibrosis patients because we have an increased need for oxygen that thus will increase our red blood cells and hemoglobin counts. When it comes to dehydration, if we have a decrease in that water content of our total blood volume, that's going to increase our red blood cells as well as our hemoglobin. You're not going to see a huge increase, but you will see a slight increase in both of these numbers. And lastly, with polycythemia vera, that's that bone marrow cancer. It's a specific type of blood cancer that causes the bone marrow to make too many red blood cells, and it causes the blood become thick and it slows down that flow, and it ultimately leads to serious complications such as clots. You're going to see a very high increase in those red blood cells and hemoglobins because of the pathophysiology behind the specific disease process. So moving to the other end of the spectrum, we have a decrease in hemoglobin, and there's specific causes that will decrease our hemoglobin. One being anemia. So if we have a patient specifically with sickle cell anemia, because of that crescent shape, it's going to inhibit the attachment of oxygen. And for inhibiting that attachment of oxygen, and we don't have that very unique bioconcave design of our red blood cells, we're not going to have enough hemoglobin for that oxygen to attach to. We also have kidney disease. If we have a decrease in that erythropoietin production with our kidney disease, then we're not going to produce enough red blood cells, thus lowering our hemoglobin numbers. Bone marrow disease, such as aplastic anemia, which is the scarring of bone marrow, will affect the production of red blood cells. Any kind of massive blood loss from trauma or surgery will cause a decrease in hemoglobin, and that's usually treated with blood transfusions. Or erythropoietin, like synthetic erythropoietin, can be given to patients such as like Jehovah's Witnesses that say can't get blood products because of their religion. So that's another option for them if we are having hemoglobin issues. And then lastly, we have thalassemia, which is that inherited blood disorder that causes you to have less hemoglobin than normal. I hope that these videos were helpful for you in passing your NCLEX and nursing school exams like a boss. If you haven't done so already, make sure that you subscribe and turn on that notification bell. That way you're informed every time I post a new video here on Nurse Cheung. Make sure you follow me on my social media. I'm on Facebook and Instagram, and check out my website at www.nursecheung.com, where I've posted additional resources such as NCLEX style questions to help you pass those exams, resources, cheat sheets, and so much more. Until next time, I hope you have a wonderful day, and I'll see you all again soon. Bye.